Why are we seeing strokes more often in young people? I mean, what could be the reasons for an increase in the 20 to 54 age group? Let's talk about this new research.
Well, it was done in the Journal of Neurology, Vicki, and what this study showed is that there was an increase from 1995 to 2005 where the total number of strokes was 13% in young people then, and it rose to 19%. So we're looking at quite a shift here. And that shift is telling us that there's a factor, or many factors that are in our lifestyle that are causing this to change.
I know that we hear in the news so frequently about the increase of incidence of diabetes and obesity and high cholesterol in our youth.
Sure. Well, there's more hypertension as well.
And all those things can increase the risk for a stroke.
Well, look what's happening to our kids. They're not exercising. They're under a lot of stress. I mean, academics have become ridiculous. They're eating food that's so full of carbohydrates and high fructose corn syrup and just table sugar. They're consuming 150 pounds a year of sugar. All these things add up, and when they add up like that, it means that we're going to have more arteriosclerosis. We're going to have a cholesterol that's going to be inflamed and tend to be sticky. Our blood pressure is going to be higher. And strokes follow that, so it's no wonder that they're happening at a younger age.
The other thing is that everybody's being brainwashed all the time about trying to take a medication for every ailment that ails them.
Oh, yeah.
For headaches, for aches and pains,
we forget
for
about
going
lifestyle.
to sleep, for
lifestyle is the most powerful medicine we have, and we just don't do it.
And
if you could sell lifestyle in a pill, these companies would make astronomical amounts of money instead of making drugs that all have side effects that cause problems for us.
And a lot of them have the side effect of causing strokes.
Well, that too.
Like the non-steroidal anti-inflammatory drugs for one.
Aspirin's another.
Birth control pills.
Sure, and you see things with HRT. People are still using a lot of hormones during the menopause.
And then what about our environment and all the toxins and poisons and pesticides and who knows what GMOs are doing to causing a stroke,
No question, all these factors are a big deal. So what we've got to figure out is what are we going to do about it? At the grassroots level, we have to start making some changes in how our kids are raised. In school, they should be doing more exercise. They should be eating food that's got low carbohydrate content to it that's nutritious. They should be using more in the way of fish because they've got the essential fatty acids that do so much to keep our level of inflammation down. And more antioxidants so that we can fight off the inflammation that comes from low antioxidant levels. All these are the factors that we could do something about that we tend not to worry about so much. But when you see statistics like this, it's frightening.
Well, prevention is key, and you really don't want to get a stroke because a stroke can really compromise your quality of life.
Well, if you can't speak or you can't move one side of your body or the other side of your body, all these things are devastating. And at a young age, we're seeing people in their 30s and 40s now start to have strokes much more often than they were 10 or 15 years ago.
So let's talk about some of the screening that's done, because I know frequently in the mail we get flyers to advertise carotid ultrasounds. That's one thing. They'll say they have a van and they want you to go do that. Is that something that people should normally do?
You would think that was the case, but the United States Preventive Services Task Force analyzed this, and what they found is that it didn't really save lives and it didn't save morbidity. All it did was cost more money. So we need to have less expensive ways of doing this without getting aggressive about what we do about it.
Well, I know that there are some tests that are not normally done with mainstream medicine,
right,
like live blood cell analysis, for example, and heart rate variability and vascular stiffness.
Right.
Why are those not accepted and done in mainstream medicine? Because those are great tests.
They don't make that much money. Doctors would rather do tests that cost more. How about doing an MRI or a CT scan, or doing a cardiac echo or some other fancy heart disease? We were doing a whole lot of heart scans there for a while. It costs astronomical amounts of money, doesn't do any better, and oftentimes we find things we wish we hadn't because they're not things that we should do anything about.
So why are these heart tests important for your brain? If you get a stroke, it's in your brain.
Well, if you have atrial fibrillation, or you have congestive heart failure, you're going to see all kinds of slowed circulation. It's going to form more clots, and you're going to wind up with more strokes. So we need to change the way we live our lives. Lifestyle is the best and most powerful medicine we have. It's not the tests. It's living your life in a way where you're taking care of yourself. And if you do that, we're going to see a reversal of this. We're going to see fewer strokes and heart attacks in young people, and maybe less in the old people as well. So that's the tip for today. A healthy lifestyle is your best medicine.